Hello, my name is Dr. Mia Kenningham. I'm from Dr. K's clinic, and today I want to explain about facial anatomy and what happens in aging and why that's important for an aesthetic injector. So first of all, I want to just show you a little styrofoam head here that we've coloured in, or my daughter has coloured in for me. It looks a bit like a fake witch doctor. But anyway, it displays what I want to explain. So this is the youthful bony architecture, and this is the more aged bony architecture. So what I want you to draw your attention to is the orbital area. It's nice and rounded in our youth, and as we age it becomes more elliptical. The extension here and here, and this has implications for why our eyes become a little more drooped looking. The nasal aperture, this is the hole that's in the skull, and on this side it's nice and small, but as we age it elongates as well and shortens that bone that sits above the lip, it's above the jawline really. Next of all, I want to show you the cheek here, the arch, bony arch here, and in our youth this cheekbone comes out. It's quite rounded and quite a good projection, but as we age it thins out and almost there's a concavity to it. In our youth the angle of the jawline is almost 90 degrees there, and it's nice and tall as it comes round to form the chin. In contrast, when we age, the angle of the jaw, we lose that and it becomes rounded, and the jaw line and the jawbone itself becomes shortened, and that's why you get that sort of shrunken lower third of the face as we age. Next of all, I want to show you the deep fat pads. Now these fat pads sit directly on top of the bony skeleton of the face. Here's the youthful side, this is the aged side. So as you can see here that the roof, this fat pad here has shrunken in size, and when that happens you get the eyebrow droop, and the eyebrow seems to come round or drop somewhat when we age. This fat pad here, which is what we call the souf, when that starts to thin, and we see evidence of it thinning even as young as in our 20s, and this is what gives you that sort of tear trough shadowing, that darkness underneath the eyes. Along the side here, this buccal fat pad, that also reduces in size, and we know as well that the cheek fat pad reduces in size. Now unfortunately, when these structures reduce in size, what happens is that structure from beneath has, bear in mind the bony resorption that has happened, all of that causes the cheek to fall forward, and this is why we get the nasolabial folds and the marionette lines that are so aging, and that sort of jowling that happens with the chin, just in that chin area. Also, when we've lost, as I was explained before, when we lose the bony architecture here, of course there's nothing pinning back the muscles and the superficial fat pads, so they all fall forward. I've mentioned superficial fat pads, and that's what they look like. Now these are the ones that increase and decrease in size according to weight loss and weight gain. Now augmenting these with weight gain does not replicate increasing these with fillers. It is visually a different look. So why am I telling you this? I'm telling you this because I think giving you the tools to understand what it is to look for in an expert injector, not necessarily me, but I think a good injector, a good aesthetic injector is somebody who's obviously safe, who understands anatomy in the areas that are no-go areas in the face, but also someone who understands the processes of aging and what has changed in your face over the years, or possibly can correct some asymmetries that may have been there from your teenage years, from your youth. It's all a good injector also understands the differences between male and female anatomy. Today I've kind of been generic, giving you roughly what happens, but it is more detailed than that. And lastly, I think a good injector has also got an artistic eye, and who understands beauty and what facial beauty is. With all that in mind, the key thing I think that makes aesthetic medicine great is that it's all these things that add up to making you look and feel great about yourself. I look forward to seeing you again soon. Bye for now. There we go. I don't have anything more to say.